I I'm sure we'll have some thought-provoking discussion, which would sort of help audiences in terms of navigating their business, and in terms of uh, helping them with their future. Disasters have been catalysts for major changes in architecture. As more of us flock to urban living, city designers are rethinking buildings, and which influence our moods in the era of neuroarchitecture. We shape our buildings, and afterwards our buildings shape us, mused Winston Churchill in 1943 while considering the repair of bomb-ravaged House of Commons. More than 70 years on, he would doubtless be pleased to learn that neuroscientists and psychologists have found plenty of evidence to back it up. The combined impact of climate change, the pandemic, economic instability, and increased mental health issues have caused seismic shifts in how people understand wellness. Far from being an optional amenity, wellness is now a cultural necessity, and therefore one of the fastest growing industries across the globe. The conversation is no longer whether wellness is good or bad. We know it is good. Now it's time to put wellness-based design strategies into action. Firstly, I'm privileged to be moderating this panel discussion, and I'm sure. Thanks, so, Mohanbir, you have experience of working in both the West and in India. I think we've been blindly following West for quite some time in terms of architecture and just creating these glass boxes, which Rakesh also touched upon. So are you seeing any change in terms of sustainable architecture because of COVID, or now because we've also, I think, Government of India has committed a net zero to achieve net zero by 2050. So, and there are even the clients nowadays, they talk about ESG and all. So do you see the change in trend and focus more on sustainability, or rather than just pure aesthetics and creating all those glass boxes?
Okay. As Rakesh just pointed out, and he has touched upon all these questions which you have just mentioned, answers to these, but just a little elaborate on that. Yes, there has been some kind of intermixing of the architecture from the West and the East and everywhere, trying to create a kind of concoction and things like that. But I think the architects, the really responsible and mature architects, know what's to be delivered, and they are doing it. So most of them are, and most of we in part of that are thinking in the right terms. But the only question and the stumbling blocks are kind of the mindset of the people, kind of demands, or some kind of natural calamities that come upon us and things like that. And that brings us to the realization what actually architecture should be delivering, and not the, like you said, just for aesthetics part of it. And those realizations are just dawning upon us right now. So from that point of view, I think one or two aspects which are now will be the dominant trends in architecture would be the eco-architecture, definitely, and the universal design. The concept of I'll touch upon both these two topics. Otherwise, there are two or three things as an immersive architecture and things like that. But I'll just touch briefly on these. And as Rakesh has already elaborated on the eco-architecture and the sustainability issues and the native species of the trees, which are all very valid things and which should be implemented. And just taking that thought forward is that whatever is the built system that we are putting into the built environment, that system is, like I said, it is going to be there after the investment life of the structure as well. So what happens to the structure after that? That is what our concern should be. See, energy conservation, yes, we should be doing it because we are facing a crunch of the fossil fuels and things like that. But once that structure is to be delivered back into the ecosystem, what are our thoughts about it? So like now if we use the native materials and things like that, which can be recycled back, that would be one aspect of doing it. These are the quantifiable issues. What are the non-quantifiable or the other issues are like that, where in the ecosystem, like Rakesh also pointed out, the biodiversity issue, which is a very valid issue. I mean, this campus for AIMS that we were doing in Guwahati, what happened was that this was in the banks of Brahmaputra, and there's just a lot of water coming in and out. So what was the strategy? I mean, the best of drainage system that you could have devised there would not have worked because of the inundation of the water which comes in just spurt of the moment. So we went in for a lot of traditional system, which was making a lot of ponds into the campus. So and a lot of swales. So what happens is when the water suddenly comes into the campus, these ponds are already there to absorb the water. Another thing, once I went to the site, I noticed that the workmen were fishing for that fishes inside that pond. So I asked them, where did these fishes come from? They said they come with the water. So I understood there's some biodiversity connection between the water which inundates into that. So what I did was I connected all these ponds because these fishes are coming from somewhere. So as if I'm going to have an kind of interjection into their biodiversity, I'm the intruder. They are not. So what I did was I connected all these ponds, so these fishes could merrily go from one pond to the other pond, and from that pond to the other pond, and then merrily go wherever they wanted. So I connected the biodiversity system. So this I only came to know once I went there and saw. But before that, I knew that I had to take care of the water which was coming in. But my awareness that these biodiversity issues have to be looked into, along with the plantation of the native trees that you very well pointed out, and all these things go on to showing us sensitivity that we are the ones who have to become part of the nature, and not that we have to just go in and save our species only. The thought has now changed. If the nature survives, we survive. So it's not just we have to look for our own survival and have energy conservation measures, but we have to take the biodiversity along with us. So that is one aspect. The other aspect is, like you pointed out, what is our approach to the architecture after this pandemic, or even before that? In 1980s, there was a term coined called as the universal design. What universal design actually says is that design for everyone. So what this means is basically is that every person, not just the average person, the young, the old, the fat, the thin, the disabled, should be able to take advantage of the design which we as architects are putting in, not only for the people who can actually are fit and healthy. So now, for example, I'll just take a little example. Let's say in a healthcare design, a patient is walking into the hospital system and doesn't know where to go, what to do, probably impaired, not in a mental state, and not able to fully concentrate on where to walking. So how do we take care of that person? First of all, there should be no steps. Probably there should be railings, which will be double level for the wheelchair and for the person who's walking. Then once you come in, then there should be some kind of a system of arrows on the ground, so that they can be told, please follow the yellow line, the red line, or the blue line on the floor itself. So they don't need to ask anyone, they can go. Next, when they are inside, probably they can't read. So there should be a push button where the instructions are audible. So once they go inside, they have a system where either they can sit down and write something, or they can stand and write something. So things like that. And our furniture as well, the medical furniture now is making a system which is adaptable. You can take down the examination table, you can take up the examination table, you can tilt it from the foot up, you can tilt it from that head up. All these things, they go into the universal design. Then you have for bariatric patients who are very fat, so we have a special rooms for them. So all this should get translated into our society as well. So this goes into the universal design aspect. So these are the two aspects, I believe, which will be taking the forefront of architecture in the coming years. Oops.
Thank you so much. My next question, move to Mohanbir Singh.
Okay.
Same question. Your views on how cities and buildings would be reimagined.
Yeah, good afternoon, everyone. And this has been elaborated by Kavita, and I guess she has covered all the questions in some answers in terms of some ballpark pointers, if I may say, like cell is what comprises a city. Yes, I entirely agree that the cell comprises a city and is a conglomerate of the cells which actually makes up. And then everything gets added like a human cell, then becomes the organism and things like that. Well, taking on from there, I would say that the pandemic has affected us in the last 100 years about 3 times, and every time we have not actually been able to give an appropriate response to that. I mean, as city planners, there are a lot of things that need to be considered. One is this: are we on a right path in terms of spacing out and strategizing our cities in terms of how the city is built up? If you see conventionally over the last 100 years, I mean, when Ebenezer Howard also propagated the philosophy of how the city and the garden cities should be designed. You see, the thing was that we had this CBD, which is called the Central Business District in the center, which was a very tower-like thing. And then the profile actually came down to your commercials, residential, and things like that. And then, it actually sprawled onto the fringe areas. And these fringe areas were those areas where the humanity, if I may, interacted with the wild and the forest, and that became the fringe area. So this is how our cities were classically designed, and that's how we have been designing, making the master plan, so on and so forth. But now, over the years, see, if I may, let's analyze the traffic patterns that in a conventional city, what happens is that during the morning time, if you see, the complete traffic converges towards the CBD, and the evening time, the whole traffic then goes out and it is going towards the fringe areas. This is the general traffic patterns that you see in a city. Is it, if comparing it with the pandemic that happens, how would you actually see this in light of that? What happens is the complete concentration goes into the CBD at that time, and then it goes out in the evening, and we are densely packing and then spreading out. You see, once we talk of the any metropolitan city or things like that, what happens is it's not just the metropolitan city, it's the satellite towns around it, about 150 kilometers. If you see Delhi, there's like people from Panipat, Sonipat, and things like that coming down into Delhi and then going out. So what happens in this conventional model of a city? First, we are bringing the people into the city, and then we are kind of loading them with whatever is there, and then we are asking them to spread out, take it to their homes, and from their homes, that I'm talking in light of the pandemic only, and then the things get spread out. Based on this model, we have been kind of rethinking. I mean, all the city planners and town planners have now been rethinking the strategy. Can we not, instead of having a singular model, have a multi-model, multi-mode, kind of small modules, self-contained modules? For example, you have a few big schools, educational centers, you have a kind of residential centers, you have the commercial centers where people go to these locations. As against this, why don't we consider having a kind of a decentralized model of a city? I mean, a negative case in this point would be Calcutta, which is municipalities after municipalities, municipalities after municipalities, spreading out and things like that. So could we also think now? I mean, this is what being brought out in the research papers all over, is that have self-contained modules in a city comprising of neighborhood centers. You could have commercials, you could have schools, you could have health centers and things like that. So what happens is that you walk down, you take some transit system which is less than 20 minutes, 10 minutes, go to these areas and come back. Now, in this kind of a decentralized systems, there are 2 or 3 things being achieved. I mean, from the pandemic point of view, what happens is that suppose there is some kind of an outbreak. Now, outbreak, I will tell you a little later how the outbreak actually triggers. Now, if the outbreak triggers, it is very easy for us to cordon off that module itself. Now, this module can then be segregated as a red zone, purple zone, or whatever zone category that we might label it as. And then what happens is that inside that, all the central resources, the state resources can, concentrate on this and then, try to contain the pandemic and then treat it properly. As against a conventional model, what we are doing is that we are first spreading it out into the complete countryside, and then we're trying to contain it. Very, very difficult effort. I mean, that is what we have been seeing, and things have been failing because of that stretching of the government resources, and then, ambulances charging 5 lakhs, 4 lakhs to transport people to the hospital and things like that. So this is one system. Now, in this system, what another advantage can be that, the emission of the greenhouse gases is also very much contained, because what you're doing is that by having this decentralized system, you are actually reducing the distance traveled by a family, the children to the school, which is nearby, to the healthcare system, which is nearby, and to the person who's working in his shop or in an office space also nearby. And then if something happens which requires a next category of treatment or something like that, then you have another system which is a next level in the center, and you have the small modules around it. So this is a modular system of city which is now emerging. And as a town planner, I may say that because town planning is something which happens incrementally with a lot of political will, and we as town planners also propagate some things which goes into master plans, and then takes a lot of time. But incrementally, if I may say, we have taken about maybe 100 years to come to a kind of city that we are in, and maybe with this pandemic going, we might take another 20-25 years to have a next level of cities which we decentralized. Now, the next thing which in this kind of a model which we must aim for is the buildings to have very, very low energy consumption and self-managed energy. Now, what happens is self-managed energy is that we have a system whereby in case of the complete breakdown which happens, there will be a loss of energy coming into the system naturally, because you don't know what has happened into the past system, who has taken ill or whatever, how the containment systems are working. So if there is a system of some solar backup or things like that, I mean, just saying that solar backup should be done, yes, how it should be done? It should be done in a way that each building can then become self-sufficient in some respect. At least the skeleton services of that building can continue. And now let's talk of the density of the system. Analysis of this pandemic which has been done, it is very logical for us to think, oh, there is a larger density, the higher rate of pandemic mortality or the infection rate. Well, let me tell you, the research says just the contrary. What the research says that there is a negative relationship between the density and the infection rate. So what does this point to? This point to that density itself is not responsible. It is the social infrastructure, it is the social distancing norms, and it is the failure of the state sanitation system which are actually responsible, and not providing healthcare. So density is something which actually will work in our favor by providing all this, the state systems, but we have to be prepared for that. So let's go ahead on this kind of a decentralized system in which all the green energy norms are maintained, and then we are able to provide the kind of social system for the people. Next, now we come to, let's say the next pandemic comes next year or after 2 years. It has come now. We have our minds opened, and we know this is the kind of system which works for us. But still, this kind of system will take an implementation of 15 years. What can we do right now? So now I will just go on those measures so we can implement right now, so that let us be prepared for the pandemic which will hit us maybe next year or 2 years after now. Now, as we are also in the healthcare, so what happens is, and a lot of people come to us and they tell us that, just excuse me. A lot of clients that they come to us and they say that they want a healthcare system right now. So now healthcare systems building can be divided into two types, if I may. One is the greenfield and the brownfield. The greenfield systems takes a lot of time to make, because you have to find a land for it. It has to be in the zone where the healthcare can be built, and then there's a project cost to it and everything like that. So I'll just talk on the ecosystem of that. And any structure, any built structure in the built environment has got two phases. One phase is the economic life, and the other is the physical life. The economic life is that life of a structure in which it gives you the return for which the investment was made. The physical life is after it has outlived its life, then what happens is that Now we don't know what to do with that structure, because now we have to return it to the ecosystem, and the ecosystem is not ready for it because nobody planned for it. All the plastics and glass and everything, what to do with it. So now adaptive reuse of the healthcare system, we've actually been doing it. I mean, let me tell you a number of projects that we did in this last COVID to put a lot of thousands of beds on the ground was done. A lot of malls were there, a lot of hotels were there. What we did was, those people came to us that hotels are not working in a place like J&K, even in NCR, a lot of malls are not working, what to do with it. So what we did was, we did adaptive reuse. We made, because structure was already ready, everything, the client was already ready. So what we did was, we planned hospitals inside them. So, need of the hour, you must have read the papers and must have been directly involved in the things, in such ventures, is that, a government was asking, gentlemen, please give us ways and means how we can put 1,000 beds right now. Right. So what I would say, and what would help the ecosystem as well, is that, can we do adaptive reuse? Definitely we can. Let's identify those structures. Let's make the client more be responsive to that. And we have done it. So now this mall in Vaishali, we converted it into a hospital. Now it's functioning as a hospital. A hotel in J&K, I mean, it's a ravaged state in terms of whatever the disturbances are happening. The hotel industry was not working. So this client said, can you make it into a hospital? We did it. So we structure was ready. We made it and converted it into a hospital. So it's something, a structure which was lying vacant. It was a burden on the ecosystem. We made it something which could provide service to the people.
Right.
So these are the kind of adaptive reuse which I would strongly recommend, which would help the ecosystem as well, and would also extend after the investment life, it would extend the life of the structure and would reduce the demand for greenfield structures, which would have sapped the ecosystem to take the energy and the materials and then used it. So we extended its life. So these are the kind of strategies which we can, go in for adaptive reuse.
Great, thanks. That was very informative. And you touched upon 2 points, like, creating models which sort of are self-sustained. So my question to...
That's right. So one line answer from our other panel members also, Mr. Mohanbir, are we going to see product innovation, especially in this, building industry, being led by design?
See, the thing is, I can just tell you something about my experience from the healthcare design. What is now happening is that, in terms of COVID also, we were going to the hospital. In the times to come, let me just tell you, the times are now going to change. The hospital is going to come to you. Now, how's that going to happen? You are going to be given some devices. These are called the wearable devices. You're going to wear it. Maybe it'll become a fashion statement or something. And they're going to give you, take the complete data from your body in terms of whatever sugar level, body blood pressure level, and transmit it to your doctor there. He's going to be monitoring it. And once it passes certain level, I mean, you don't have to go to the hospital every time. You are being told by your email or something like that, now you require this kind of a treatment, that kind of an intervention, come on the telemedicine. So telemedicine is another next level. After the wearable, you go to the telemedicine and then you get connected to the hospital. Hospital advises you. So, imagine the sustainability. You're not traveling to the hospital every time, straining the infrastructure of the transportation, the greenhouse gases, and the load in the hospital and things like that. So in the healthcare design, like you said, the innovations in the Apple and everything, please wait for next 2 or 3 years. I mean, since we are involved with lots and lots of hospitals, everything, lots of changes are going to come the next 2 or 3 years.
Yes, we have an example of Apple Watches where they have sent a distress signal to the healthcare if the person is in
that is
distress.
Just the beginning of it.
Yeah, so that is a beginning. Mr. Rakesh Kumar, how